This is Philip Dimitrakis with U.S. Benefit Solutions, and I'll be conducting the presentation today. I am Vice President of U.S. Benefit Solutions, and I'm also a licensed insurance agent and certified in the individual and shop marketplaces. Starting October 1st of 2013, the marketplace will provide 5 levels of coverage to consumers. Now, those 5 levels are catastrophic, bronze, silver, gold, and platinum. The catastrophic plan will provide lower average premiums than the other 4 levels. Preventative services will be covered 100%. Out-of-pocket maximums for an individual is $6,350 and $12,700 for a family. Now, in order to qualify, you must meet the following requirements. You must be under 30 years of age, have no other option for coverage, such as an employer-based plan, and you must qualify for a hardship exemption. The catastrophic plan is a great option for someone who only needs coverage for the unexpected expenses, such as hospitalization or surgery. The bronze plan offers 60% coverage to individuals and their families. Preventative services are covered 100%. The bronze plan will also consist of co-pays, deductibles, and coinsurance limits. Now, the annual cost-sharing limit for 2014 is $6,350 for an individual and $12,700 for a family. The bronze plan is the most economical plan a consumer can purchase that provides some basic benefits such as co-pays for doctor visits, where the catastrophic plan that we just discussed doesn't give you coverage for the basics such as co-pays for doctor visits and diagnostic testing. The silver plan offers 70% coverage to individuals and their families. Preventative services are also covered 100%. And just like the bronze plan, the silver plan will also have co-pays, deductibles, and coinsurance limits. The annual cost-sharing limits for 2014 are $6,350 for an individual and $12,700 for a family. Now, the silver plan is the lowest of the 5 levels that you can purchase in order to qualify for cost-sharing reductions, which we will touch on later in the presentation. The gold plan offers 80% coverage to consumers. Preventative services are covered 100%, just like with the catastrophic plan, the bronze plan, and the silver plan. This plan will also have co-pays, deductibles, and coinsurance limits as well. The annual cost-sharing limits on the gold plan are $6,350 for an individual and $12,700 for a family. The Platinum plan offers a 90% coverage to consumers. Preventative care is covered 100% as well. This plan will also have co-pays, deductibles, and coinsurance limits. The annual sharing limits on the Platinum plan are also $6,350 for an individual and $12,700 for a family. The cost-sharing limits define the amount the consumer is responsible for before the issuer or insurance company pays for the services 100%. Premium tax credits will play a very important role in the plan decision making on the consumer's behalf. In most cases, depending on how substantial the tax credit will determine which plan the consumer can choose to purchase. Now, the premium tax credits reduce the cost of premiums paid by the individual and their families. Now, in order to receive a premium tax credit, you must purchase a plan within the marketplace. You can also elect to receive your tax credit in advance. Now, if you choose to receive an advanced premium tax credit, the tax credit is paid directly to the insurance company to pay towards your monthly premium. So the tax credit will not be reimbursed to you to pay your premium, it is going to be paid directly to the insurance company. Keep in mind that the IRS will assess your tax credit for accuracy at the end of the year. So just make sure that you are as accurate as you can be with how much your household income and family size is. The marketplace will provide documentation of the tax credit for your records. Premium tax credits are based on household income, family size, and the cost of a silver level plan. Remember, the silver level plan is the plan that provides 70% coverage. Now, the amount of tax credit that you will receive depends on the specific plan that you select. Now, let me give you an example so that way it does make a little more sense. Let's say Family A is eligible for a maximum tax credit of $800 per month. Now, they select a qualified health plan that costs $1,000 per month. If Family A elects to receive the full amount of the tax credit in advance, then the tax credit of $800 per month will be paid directly to the issuer or the insurance company every month. Therefore, Family A will pay the remaining $200 per month for that coverage year. So the family's true premium, if you will be $200 per month every single month, because it was initially $1,000. The tax credit is $800, so you subtract that from the $1,000, leaving you with $200 per month. So who is eligible for a premium tax credit? Eligibility is based on household income and access to minimum essential coverage. Now, in order to qualify, you must not be eligible for Medicaid, CHIP, or Medicare. Your gross annual income must be between 100% to 400% the federal poverty level. You must also be part of a tax household that will file a tax return for that coverage year. And finally, you must be eligible for coverage through a qualified health plan or QHP. Remember, you must purchase a plan through the marketplace in order to receive any type of tax credits. Another function of a marketplace is to offer cost-sharing reductions to consumers who qualify. Now, cost-sharing reductions limit the out-of-pocket costs or expenses on benefits covered by the qualified health plan. Now, the reductions are based on household income and family size. The cost-sharing reductions help reduce deductibles, co-insurance limits, and maximum out-of-pockets. Please remember that cost-sharing reductions have no impact on your monthly premium on your plan. The cost-sharing reductions have an impact on the actual benefits. So who is eligible for cost-sharing reductions? The consumer must first meet the eligibility requirements for a qualified health plan. They must also meet all their criteria for eligibility for a premium tax credit, which we did discuss earlier in the presentation. The annual household income must be at or below 250% the federal poverty level. And finally, the consumer must be enrolled in a silver plan. Now, the last two requirements do not apply to federally recognized Indian tribes. Throughout the presentation, you've heard me reference federal income guidelines and FPL, and you're probably wondering what all that means, so I'll go ahead and define that for you. To determine if you qualify for tax credits or cost-sharing reductions, it's important to know the federal income guidelines, or FPL, and where your gross household income fits in. Now, if we take a look at this slide, there are three columns. On the left, you have household incomes that are between 138% and 250% the FPL. In the middle are the household incomes between 250% and 400% the FPL. And on the right are the household incomes that are 400% or higher, the FPL. Now, on the left-hand side of each post-it, you have numbers 1 through 6, and this signifies the number of people in your household. So, for example, If your income is between 250% and 400%, the federal poverty level, you have 3 total members in your household, then your annual family household income is between $48,825 and $78,120. Now, if your family household income is less than 138%, the federal poverty level, then your family qualifies for Medicaid and SHIP. Now, if your family household income is more than 400%, the FPL, then you're not going to qualify for any tax credits or cost-sharing reductions for that coverage year. And finally, if your family makes between 138% and 250%, the FPL, then your family will qualify for premium tax credits as well as cost-sharing reductions, where if your family makes between 250% and 400% the federal poverty level, then your family only qualifies for premium tax credits. Now, it's very important to keep in mind that in order to get those cost-sharing reductions, you do have to be between 138% and 250% the FPL, along with purchasing at least a silver plan. The tax penalty is something that individuals and families will have to pay if they do not purchase a qualified health plan starting in 2014. Now, the tax penalty in 2014 is $95 per adult and $47.50 per child, with a maximum of $285 for the year for the family, or 1% of the gross income, whichever is greater. In 2015, the tax penalty is $325 per adult and $162.50 per child, with a maximum of $975 for the family for the year, or 2% of the gross income, whichever is greater. In 2016, the penalty is $695 per adult and $347.50 per child, with a maximum of $2,085 per family for the year, or 2.5% of the gross income, whichever is greater. Now, there are ways you can avoid the tax penalty or fee. If you're uninsured for less than 3 months out of the year, you can avoid the fee that way. If you are determined to have a low income, or the coverage available in your marketplace is considered unaffordable, you can avoid the tax penalty there. If you're not required to file a tax return because income is too low, members of a federally recognized tribe are also exempt from the tax penalty. And you also can avoid paying the tax penalty if you participate in a healthcare sharing ministry. And finally, if you're a member of a recognized religious sect with religious objections to health insurance.